All right, it is 5:01, so good afternoon or early good evening, everyone. My name is Rebecca Davis, and I work at the Federation for Children with Special Needs. We are the Massachusetts Parent Information and Training Center for the entire state of Massachusetts. I'm also the mom of a complicated kid who has a visual impairment and hearing loss. She also has a diagnosis of cortical or cerebral visual impairment. So it is with great pleasure that this month for our Connecting Families series that we have representatives from the New England Consortium on Deafblindness to come and talk to us today. So I'm going to turn it over to Beth Bostic, who's one of our honored revered board members, and she will help with the invitations or the moving on. Go ahead, Beth. I've lost my word.
Thank you so much, Rebecca, and welcome everybody. It's so wonderful to see everybody today and to talk about this really important topic around how to really support students and children with the combined condition of deafblindness and their families. We have three wonderful speakers to help us with that. The first one is Tracy Luiselli. And as the director of the New England Consortium since 1999, Dr. Luiselli has provided extensive consultation and training to families, schools, and agencies serving children who are deafblind. Her areas of interest include assessment and instruction for deafblind children, congenital, I hope I don't butcher this word, cytomegalovirus, brain-based visual impairment, and organizational leadership and management. She advocates for family engagement in all aspects of educational programming, including helping parents develop home-based routines that support their children's communication and independence. So please join me in welcoming Tracy this evening. Also with her is Brenda Allair. Brenda has been passionate about education since her undergraduate studies, but it wasn't until her youngest daughter was born that she learned more about the fields of early intervention and visual impairment. She spent several years working at the state level with the Massachusetts Department of Public Health as a teacher of children with visual impairments at Perkins, and is now the lead educational consultant for NEC. Her areas of interest include support for children with complex healthcare needs and their families, and early childhood education for young learners, and assessment and instruction for deafblind children. So please join me in welcoming Brenda this evening. And last but certainly not least is Kristen Layton. Kristen is an educational consultant at NEC. Her background and passion is in working with children who are deafblind and inclusive education. Kristen worked for many years with Perkins International, Perkins School for the Blind's International Division. She has held positions at the Education Development Center, Boston College, the University of Maryland, the National Deafblind Project, the Helen Keller National Center, and as a special education teacher in a New York public school. So please join me in welcoming Kristen as well. Before they get started, just a couple of housekeeping items. We do as normal have Wordly available, and the link is in the chat so that if you need interpretation services, they are available to you. If you do have questions along the way, please put them in the chat and we'll be able to address them either during the presentation or immediately following. If you are not speaking, if you could please mute your microphone so that we can make sure there isn't any interference with the speakers during that time, that would be fabulous. So I am really excited about this topic, having had a child who had presented with CVI traits and also had a hearing impairment. This is really exciting to have this discussion as a medically complex mama. So thank you so much, ladies, for coming and joining us tonight. And you now have the floor, or the screen, if you will.
Great. Thanks, Beth. This is Tracy. Just thank you for reading those bios. On the other hand, I just want to say it's Tracy, Brenda, and Kristen here with you tonight. So we're really thrilled to connect with you. And I want to thank you for reaching out and allowing us to give you an overview of sort of who we are at the New England Consortium. And our objectives for tonight is to kind of give you an overview of NEC and combined vision and hearing loss, the importance of sensory assessment. We'll talk about functional vision and hearing assessment and intervention, including CVI considerations, environmental considerations, the importance of accommodations in the IEP, and then some resources and training opportunities. And what we don't cover tonight, please know that we're here to help support you and answer any questions. So please don't hesitate to reach out afterwards. So just to give you a little bit of a snippet of the New England Consortium, we've been around for a really long time, since the late 1960s, early 70s, as a result of the rubella epidemic. And our population, as you can imagine, has changed dramatically. But we're funded by the Federal Office of Special Education Programs, known as OSEP. And our charge in terms of our funding is to build state and local capacity to serve this very unique population of children who are deafblind or at risk. We work with children from infants up to the age of 21 in the states of Connecticut, Maine, Massachusetts, New Hampshire, and Vermont. And some of you know our regional offices at Perkins, but the vast majority of services that we're providing at this point are virtual. I wanted to kind of step back and just talk about this term deafblindness, because sometimes it closes some windows instead of opens windows, because people don't understand really the population that we're talking about or the term. But deafblind really refers to any combined hearing and vision loss that significantly limits the child's ability to obtain information from people and objects around them. The term deafblind, people often conjure up that image of Helen Keller or a child that is unable to see or hear anything, when in fact, the vast majority of children that we serve do have some residual vision and hearing. So it's rare that we have a child that would have no vision or no hearing. Just thinking about the term, I think it's really important as a takeaway this evening that people understand that deafblindness, or the term combined vision and hearing loss, is really a disability of the distance senses. So these are two pictures that I took this summer. The first on the left, I was out walking on the beach in one of my favorite places in Maine that will remain secret. But I was walking on the beach and there were these piping plovers just dancing around, and the waves are coming in, and I can see off in the distance, and I can also hear people on the beach. I can tell by where the waves are, whether the tide is coming in and coming out. And then the picture on the right is a picture of boats, and I can hear the sails coming down. I can hear people off in the distance and off in the harbor. So I think it really underscores the importance of reflecting on how children who have combined vision and hearing loss, or combined vision and hearing loss, deafblindness with additional disabilities, how they perceive the world, and the importance of all of us working together to develop strategies that help that child understand what's happening in the immediate environment. So you can think of the classroom with people darting in and about, with peers playing with different materials, talking to each other, engaging with each other. Many of the children that we're talking about here aren't able to experience that in the same way. And there are strategies that we can do to help them understand and to learn. The population in and of itself is incredibly diverse, and 90% of children who are identified on the federal as well as state deafblind census have additional disabilities. It's rare that they wouldn't. For children with complex needs, we often see that hearing and vision loss are not recognized or addressed because families are working on all of those other issues that may be quite critical at that moment. And also, this is especially true for children who are deafblind that have brain-based visual impairment that may go undiagnosed or even go undiagnosed for many years. This is a chart that I like to use, especially with families, to kind of show them the range of sensory abilities and conditions that we're talking about that could really put a child under that umbrella of combined vision and hearing loss, if you will. So At the top, you'll see the classifications of vision and the classification of hearing on the left. And then the more sort of neurological or brain-based conditions such as CVI or auditory neuropathy or central auditory processing disorder are at the bottom on the left, on bottom of the chart, and then over to the right. Any of these boxes that are shaded in blue or shaded at all in gray would indicate a child is eligible for services and would fall under that umbrella of deafblindness. Having said that, it is always up to the team how teams want to identify a particular child based on the child's learning needs. So while we promote that a child be identified as deafblind on the IEP, it ultimately comes down to the IEP team's decision. But this graph we find really helps people understand the population and the range that we're talking about. Now, looking at the number of children in Massachusetts who are registered with us, there's a total of 236 children. We know just that 236 is under-identified, especially in children birth to age 6. But this particular bar graph here shows you the number of children in Massachusetts who have deafblindness as well as CVI. And Brenda's going to talk about that a little bit more. But again, you can see birth to 3 and then 3 to 5 early childhood. And then as kids get into school age, and then a large number of the population is transition age. So that kind of gives you an idea of just the deafblind population alone, but those children who also have CVI. And again, many of the other children that we see who might not be identified as having CVI, we work with a lot of teams to encourage them to get further additional assessment. You may hear all kinds of terms, things like Deaf Plus, which is used a lot in the programs for deaf and hard of hearing. You may hear complex healthcare needs, multiple disabilities, combined vision and hearing loss. I just want to mention that a lot of our children are identified under that term of multiple disabilities. We cringe a little bit with that because it doesn't identify the sensory needs for these kids. And just by identifying under multiple disabilities, we see kids go on for years and years and years, and teams not ask the question, well, is this child's vision and hearing okay? Does it seem developmentally the child is progressing in the same way? Or when was the last time it was evaluated? So what we always say too, if there's a visual impairment in one particular area, you always want to additionally evaluate the other sensory, whether it's vision or hearing. And with that, Brenda, I'm going to pass it over to you.
Thanks so much, Tracy. So we wanted to talk a little bit about some of the risk factors that might be happening for kids that would potentially cause a combined vision and hearing loss. So there's a number of different kind of categories that put children at risk for developing vision and hearing problems. And these sort of fall into major categories like prenatal complications. And that's usually things like infections or exposure while the child's in utero. There's sort of a number of birth complications that can happen that are associated with combined vision and hearing loss, and that includes treatments that are associated with a premature birth. So for example, low birth weight, and then any kind of mechanical ventilation, children who've been requiring certain kinds of treatments while they were in the hospital in the NICU. And then, of course, there's a number of genetic syndromes or disorders that we know are historically associated with combined vision and hearing loss. Some of the really common, well, the conditions of them aren't common, but commonly associated are charge, Usher. There's a number of other conditions as well. What we also know is that there's a lot of children now being diagnosed with very rare conditions. And they may be one of only a handful that's been diagnosed. And there's very little known about some of these conditions. And so those are children that should be closely monitored for both vision and hearing, again, because we just don't know the outcome for some of those. And then additionally, children who have a history of something like brain malformations that were diagnosed perhaps by an MRI children who have a history of brain tumors or treatment with chemotherapy. And then any children who've suffered accidents or injuries that involve trauma to the brain or their eyes and ears. And that also would include, children who have some sort of traumatic event at birth. And then children who have multiple disabilities that perhaps don't have a unifying diagnosis. So perhaps they haven't been diagnosed with a genetic condition, but they do have a number of disabilities that are impacting them. And as Tracy mentioned earlier, sometimes those children are not fully evaluated in terms of their vision and hearing, and they can be delays in how long that takes for them to get a diagnosis. So those are sort of things that we'd like to alert families to, as well as professionals, in being aware of risk factors for kiddos. This is just a little bit deeper look at some of those risk factors. Again, the hereditary syndromes or disorders. This includes things like mitochondrial disorders, some of the rarer things like a peroxisomal disorder. Premature birth, again, there's so many complications that can happen with a premature birth that often things aren't being assessed in the same way that they would for a typical healthy newborn, because there's just some critical medical things happening. So those kiddos might need to be evaluated over time in terms of their vision and hearing. Severe trauma can happen obviously at any age, unfortunately. And so even children who were slightly older, when they experience some kind of trauma for head, eyes, and ears, should be assessed. Kiddos that have a family history, especially a family history of a combined vision and hearing loss, that may be somebody who wasn't diagnosed with a syndrome because it was many years ago when we didn't have as much access to genetic testing, but there's a family history there. And then around CVI, we know that the conditions that are associated with a diagnosis for CVI are also frequently potential risk factors for deafblindness as well. So kiddos who have a CVI diagnosis, as Tracy mentioned earlier, we want to make sure that they're getting their hearing assessed as well, so that none of that is being missed, so that they have as much access as possible to the world around them. And of course, we know that there are many faces of kiddos with deafblindness, combined vision and hearing loss. There's a wide range. It's a very diverse population. Most of the children that we provide services to have some degree of usable vision and hearing. But the combination of that sensory loss is what makes them really unique as learners. And that's kind of what we wanted to dive into today. And Tracy, I know you wanted to talk a little bit about some of the focus on education around children who have this combined vision and hearing needs.
Sure. So I think that it's really important that families are encouraged to think about their child around their competence and what they can do, and not be sort of bombarded with so much information all the time about what their child can't do. And the whole notion that learners are not limited by what they can learn, but by how and what we teach them using effective strategies. So I think sometimes, I get a little disappointed when I'm working with teams and I encounter families that seem so beaten down by the list of all of the things that their child has experienced medically and all the things that have occurred, that I think it's easy for all of us, providers, professionals, as well as families, to really forget about the whole notion of assuming competence. And for many of these children, we don't always know at the beginning exactly the trajectory of learning, but we do know that all of these children can learn, given the right supports and instructional program. I also wanted to go out on a limb, and Brenda and Kristen, you don't have to, I won't put your names here of approval on here, certainly if you don't want to, but I wanted to just mention the whole notion around service delivery for this population of children who are deafblind, as well as deafblind with CVI, that the decisions around service delivery for a child in that IEP process, around the format, where it should occur, how often it should occur, that should be based on what the child needs and not assumptions about the child's limitations. too often we see, a particular service provider just said to me recently, well, this child is so involved, I really don't have to spend a lot of time. And I would submit that's exactly the opposite, that for many of the kids that we work with, they need more services, and it may be in the form of consultation, but I think that just writing kids off based on where they are with vision, hearing, and complex needs is incorrect. I would also like to submit that when we see 30 minutes a month of consultation on an IEP, I believe that it rarely serves the child in the classroom well. So that's just a little tidbit I wanted to put out there, and I'm happy to discuss it later if people want. But I really think that the team, that whole notion of assuming competence, and that we're here, our charge is to provide access, visual, auditory, and tactile access to these students around the people and objects and activities in their day-to-day world, to provide meaningful learning activities. And then thinking about how do we build trust for children who don't understand all of the things that are changing in an environment, whether it's the classroom or out in the community. The way you build trust is by having consistent staff. If the staff are constantly changing, children can't begin to understand and anticipate what's coming next. And that's really critical for their communication system, which we really would hope is founded in appropriate assessment. So that just kind of lays the groundwork of the whole educational profile for these children.
Thanks, Tracy. We're going to dive in a little bit to some of these topics and really thinking about, for families, how this translates into IEPs. You know, how does this look for your child's education? So we know that all of the children that have combined vision and hearing loss have an impact on their education and their specific learning needs. But how those impacts happen is really varied for each child. So, for example, the age of the onset of the vision or hearing loss. And for many of our kids with CVI, the age that they were diagnosed with CVI can also have an impact. You know, if they were diagnosed when they were really young, families might have had access to lots of resources and information versus children who are diagnosed later after school age, you know, and haven't really had the same amount of access either within school or family resources. So those are important things to consider. Again, the age that children are identified as having a combined vision and hearing loss, that can really impact how much the educational team knows about the child's needs. It can impact how we interpret what the child's doing in a classroom. So if we don't know that a child has a hearing loss and we interpret certain things as behavioral, when really they're a result of a child's hearing loss, obviously that's going to impact how we treat them and the ways in which we think about their education. The degree of vision and hearing loss obviously is unique to each child, as again, are the presence of additional disabilities and how they impact that unique child. So most of the children that we work with that have hearing loss will have some services from a teacher of the deaf, often referred to as a TOD. And that person can be a real resource to the team in explaining the impact of hearing loss on that particular child in terms of education. The way that the child needs supports will depend on the type and degree of hearing loss, preferred method of communication, and I would also say emerging communication. So some children haven't identified yet their preferred method, but they are still communicating. And how is the team thinking about communication for that child? Is the child using hearing aids or cochlear implants? And then things to think about in terms of IEP planning, you know, either as a family or professional. Has somebody taken a look at the impact of environmental background noise? Classrooms and schools are noisy, chaotic places, right? Even a calm classroom can have a lot of activity. So how is that impacting this child? Are they seated somewhere there where they can hear what's happening? You know, is there a lot of noise that other kids can tune out, but that it's really disruptive for that child? Is staff aware about, you know, how to communicate effectively, such as facing the person, keeping hands away from your mouth? And this is really important. The level of fatigue that these students have can be really significant. They may have medical issues that cause them to be fatigued, but sensory issues alone can really create this fatigue that requires frequent breaks, and to be aware of that kind of before it becomes a problem. And then similarly, students who have a diagnosed vision impairment, most of them have services from a TVI, a teacher of the visually impaired, again, who can act as a support to the team in helping the team understand how the vision loss is impacting their learning. But some things to think about is, what type of vision loss does this child have? Is it from an eye condition, or do they have a diagnosis of CVI? Do they have both things, which can happen? We want to know what the impact of that child's cortical cerebral visual impairment is on their ability to see within the classroom. How do they see best? What's the impact of light for that child, for example? And is there an issue with competing sensory information? So for a lot of children who have a visual impairment, and again, these kiddos that have combined vision and hearing, the amount of sensory information that's happening in a classroom can be really overwhelming. And so we have to think about, how do we mitigate that? And then, do they have additional disabilities? Do they have concerns around motor planning that we might need to think about a communication system? Do they have an additional disability that makes it difficult for them to sustain attention? So different things like that. And then we know that there's some brain-based vision impairments or vision and hearing impairments that are not a result of damage or abnormalities in the eyes or ears, but really a difficulty in how the brain interprets information. And the things that I like to tell teams is, for children who have these brain-based conditions, for some of them, their eyes and ears might be otherwise typical, but the fact that they are looking doesn't mean they're seeing and understanding. And the fact that they appear to be listening doesn't mean they can hear and understand what's being said. And so all of that information is filtered through these pathways in the brain that have to interpret information. And you can imagine how kind of fatiguing that could be, especially if you have a combined vision and hearing loss. So the impact, obviously we've talked a little bit kind of about each piece. And I want to let people know I am seeing some of the questions pop up, so I'll take a pause in a second so we can address some of those. The impact of combined vision and hearing loss is, obviously happens beyond infancy, even in things like bonding and attachment. So young children are continuing to develop bonds and attachments, including with their teachers, their related service providers. And all of those relationships that are crucial to learning can be impacted by vision and hearing loss. Does the child know who's interacting with them? Do they understand the expectations of that person? Can they build a trusting relationship so that all of those interventions with that person can be effective? As I said before, children can be appearing to look and listen, but the information that they're getting is limited or lacking. And maybe it's incomplete or distorted. And so that impacts their ability to not only gather new information, but to apply things they know to new situations. One of the biggest issues that combined vision and hearing loss has is on communication and language. So much of our communication with others is verbal and nonverbal. So for kids who can't correctly identify all of those pieces of information, the impact on communication, these children can miss pieces of information, but they can also be misunderstood and they can misunderstand. And you can imagine over the course of even one school day, how frequently that could have an impact. It can also impact what types of communication is available to the child. Is it a child with a hearing impairment who has limited vision? So sign typically might be challenging for them. They need understanding communication partners who can have patience and waiting opportunities. And then again, fatigue is a huge issue for some of these students. Again, also, differences in how everyday activities are experienced. And I think about this a lot around playground activities or social experiences, if you can't efficiently, see and hear using your distant senses, we've all sort of been on the playground when the kids kind of flee out onto the play area, and then things are happening, they're very quick. And how does that child integrate? How do they participate in those activities? And so those are really important things to think about. So we can pause for a second, and Beth, if you want to look at some of those questions.
Sure. One question is, how does one get a teacher of the vision impaired when the child attends a virtual school?
That is a great question. Are they attending virtual school through like a public program?
Yeah, I was wondering that myself. Are they attending virtual school through their local school district, or are they attending one of the state's virtual schools, or is there a different virtual school they're attending? Because we're trying to understand the context for this.
The
Barbara?
child attends, considered a public school online. Not in my local district, but it is still a public school.
So it's one of the two virtual schools that the state has approved?
Yes.
Okay. All right. So, and
I saw that
because
you
they
were-
are two
I
schools
was giving you a
through the
second.
state, that means they are required to provide special education services. So the question is, how do you access those?
So if they have a diagnosed vision impairment, they should have had an assessment for that. That's actually what I'm going to talk about a little bit next. But if they've had an assessment that identifies them as a student who has a visual impairment for which they need support, so in virtual school, for example, maybe they need bigger font size, maybe they need extra time to complete assignments, just off the top of my head. Then the district would be responsible still for providing those services, and especially if it's incorporated into their IEP. So that would be something to think about. If they haven't yet been identified, but you have concerns about their vision, you can also request an assessment as a suspected disability.
This child has a visual impairment diagnosis, but we have an appointment next week for a secondary evaluation, second opinion evaluation,
Mhm.
because I'm seeing some concerns that I've seen all along. It just has gradually gotten worse.
Mhm. And I think that's an important point. A child can be diagnosed with a vision impairment, but still be, they're still accessing information well. Maybe they haven't really needed the services from a TBI, but over time, your vision can change. And so maybe
She has a diagnosis of ASD level 3, PTSD, ADHD, severe anxiety separation, and mild sleep apnea and asthma.
In addition to the vision impairment.
Yes,
Yeah.
Okay. It definitely falls in that complex category.
that's why I opted when the pandemic hit.
Mhm.
We managed to make it through pre-K and brick and mortar. But when the pandemic rolled around and she hit kindergarten, I pulled her out. I have 2 other kids that are in virtual school as well. The second one is also autistic, but the third one, she's there because of bullying in her 2nd grade, and she's now in 7th.
Mhm.
So I've been at this for 6 years.
So Brenda, this sounds like a great place to start really talking about assessments.
I think this is, and I think I was looking at some of the other questions in here as well.
Related to that as well. Yeah.
Yeah, because I
they're-
have the 2 little ones I have had 3 years now, and I have permanent guardianship of them. So it requires an awful lot involved
Mhm.
to deal with
can
them,
imagine.
but I'm trying to figure out how to access things better, because they have severe anxiety about going back to a brick and mortar. They don't leave the house without one of us.
I
Right,
think this is
so-
a really good, yeah, I think this is an important place to talk about assessment in encompassing kind of a variety of areas, right? So we know that the most important thing for students with combined vision and hearing loss, and I would, argue with all disabilities, but specifically for this population, is, trained personnel who understand the complexities of their needs. And the way that we understand those complexities is through assessment. And so students can be assessed, should be assessed in all areas of their suspected disability. So, a diagnosis in one area doesn't preclude the fact that they could have other issues going on. And sort of to the point that we were talking about earlier, things can change over time. And so that's the point of having ongoing assessments and making sure that those things are being assessed by people who are trained in understanding the complex needs for these particular students. So a teacher of the visually impaired who has had some deafblind training or understands complex health needs and CVI, teachers of the deaf who again have had training around deafblindness and understand auditory processing issues. The importance of comprehensive assessments, by which we mean looking at the whole child and looking at a collaborative effort. These aren't kids who can go into a room, have an assessment provided to them, and then you get some information. They often need a lot of accommodations for assessments. They might need observational assessments, but they should have really good, sort of the three key pieces here, I would say, are a functional vision assessment, which is different than clinical information. So functional vision looks at how is that child using their vision to access the kinds of things we expect their peers to do. So somebody asked a question about reading, for example. How is the child looking at print? Can they even use print? Do they not have enough vision for print? Do they need tactile modes for literacy? How are they able to access things that are at a distance, like the teacher or a display board or any of that? A CVI assessment, particularly for kids that have a brain-based vision impairment, really looks at all of the ways we know that processing impacts vision. And then functional hearing assessments, similar to vision, to look at how is the child using any residual hearing to access the information that's happening in school and what things are impeding their access. So for example, maybe the child has pretty good residual hearing when they wear their hearing aids, but they have a lot of behaviors, and so they're not wearing those hearing aids most of the time. We need to think about that child differently than we would a child who is able to keep them in all the time. And again, that requires the collaboration and training of team members across disciplines. So TVIs working in collaboration with special educators, perhaps with physical and occupational therapists, to really look at the comprehensive needs of these kiddos, and then to identify how we're going to support them moving forward. The reason that we talk a lot about the importance of assessment for these kiddos and the reason why they're, different, unique learners is because typical sighted hearing children learn an enormous amount of information about the world incidentally. This is the way that we all, as a sighted hearing adult, this is how I learned about the world. I can look around, I can listen in on conversations. I'm a pretty big eavesdropper. I can see what's on television. I can kind of hear in the car with the radio. There's a lot of things I can learn about the world without even really trying. And then I might learn more by listening to a teacher or going to a presentation. And then perhaps I dive in and I really get my hands into an activity. So, a science lab where I can manipulate things and I learn a little bit more. For our students who have vision and hearing loss, we really have to think about flipping that entirely. Their incidental learning can be very limited. They might not be able to visually observe or to listen. if they can, they might have big gaps in those pieces of information. They absolutely need direct hands-on instruction to develop a full understanding of concepts. One of the things we think about a lot is kids who can sound like they understand something, but don't have the conceptual knowledge in order to take that information and build on it. And so we really need to think about, do they have the same knowledge base as their peers? Do they have shared experiences that we can build on? And so we have to think about, how do we create an environment that allows children to learn, and specifically kids with combined vision and hearing loss? We know that there's some environmental considerations we really need to put into place. We know that kids need predictable and consistent routines and structure so they can anticipate what's going to happen and then participate in those things. And we know that crucially, communication is essential, and that their communication might look a little bit different than their peers. And we'll talk a little bit about that. So environmental considerations, this should really be, an important part of the IEP. I feel like sometimes it gets glossed over because people are really looking at, literacy and all of those pieces, but you can't get to literacy if you can't access the information. So in order for students to be able to maximize their use of vision and hearing, we need to think about what kind of visual and auditory clutter is happening. Do we need contrast or highlighting? Is the physical setup of the room conducive for that child? And then predictability and consistency are absolutely crucial. Students need the ability to know what's about to happen so they can prepare to participate. And then we know that all behaviors communication, even children who are using unintentional methods of communication, we can shape that into intentional communication. But it's up to us as parents and as educators to really think about, what is that child trying to tell us? And how does that child receive information so that we can be good communication partners? So some of the crucial things to consider when you're looking at an IEP for a child who has combined vision and hearing loss is there a TBI and or a TOD associated with the child services? And I saw in the chat questions about a limited number of service providers. I can tell you as a TBI, yes, that is a problem. But it's really important to acknowledge that that's still a person that your child needs on their team, and how the school is going to think about the ways in which your child's going to access that. Perhaps there's some consultation services that somebody could provide. There might be other methods, but thinking about who are the important members of that child's team. We talked a little bit about ongoing assessment. It can't be a one and done for these kiddos because things change for them rapidly. And we need to know how they're accessing different pieces of information. Wait time is crucial for these kiddos. Tactile cues are really important. And that can be important even for kids who have some vision and hearing. Tactile cues might be the way they continue to make sense of the world and kind of establish more knowledge. Do they have communication systems that have all of their strategies embedded? There's a lot of information here around sign language, and that's especially important for kids who have a visual impairment, including those with brain-based impairments, because we need to know how the CVI impacts them so we can think about, if we're utilizing sign language, can they participate in that? Can they see and understand it? And again, we talked about breaks and modifying materials and environment. So some of the modifications for an environment could look like reducing visual clutter. They could look like highlighting salient features. So one of the pictures on the bottom, you'll see the teacher's got a very busy background. She's trying to read a book. If I'm a child with CVI, I might not be able to pay any attention to that book because there's so much else happening. But when we reduce that clutter, it really changes, all of a sudden now the little fish is popping out. And making sure that the TBI and TOD and anybody else on that team who's really important to you considering environmental modifications is consulted, whether that's around CVI, whether that's hearing, whether that's around the child's ability to move throughout the environment, just to be considering different kinds of environmental changes. The use of touch is important, as I said, for communication. Even children with useful vision and hearing benefit from the confirming information that comes from your tactile senses. If you get up in the middle of the night to use the bathroom and your house is dark, you might stick your hand out even though you know your way to the bathroom. You're using that confirmation of, yep, that's where the wall is and I'm not going to bump into it, as a confirming safety piece for yourself. And similarly, students will do the same. But we might need to specifically teach these things. We might need to use hand under hand strategies or touch cues to help children anticipate when somebody's going to be talking to them. Joint attention is really critical, right? This is the critical piece of learning. I'm going to learn something when we are sharing an experience. For a lot of our students, that experience is tactile. So these two little guys are playing in the Lego blocks together. They're sharing this experience together through touch, and that can be the basis for language development. If you think about tactile symbols, tactile sign, different kinds of communication, and it's a way to establish and build trust in a relationship. And I just love this image of, touching a teddy bear together and you're signing or saying the word, and then over and over again this happens, and then a child begins to associate this object not just with the word, but with that shared experience of developing language and talking about something together. Personal identifiers, again, around building relationships and anticipating routines. Students who have difficulty with vision and hearing, they might not be able to see or hear who's interacting with them, or even to identify familiar adults. We know for kids with CVI, recognizing mom in a face of other women can be challenging. So thinking about, even though that's the teacher they see every day, if she's wearing different clothes or her hair is different, they might not be able to quickly recognize her. So personal identifiers help these students to associate the symbol with the person and then support that relationship and allow the student to anticipate activities. I always think about physical therapists who might be manipulating a child. They're going to have hands-on bodies. And so being able to anticipate as a child, oh, this is the physical therapist, and that's the activities we do together, can help ease some anxiety around that the child might have. And of course, always greet your students, always, encourage your child's teachers to greet them. They can't just wave quickly sometimes and be acknowledged. We want children to have positive relationships with the adults in their lives. I feel really strongly about literacy. This is kind of a big area for me. So all children, regardless of their developmental needs, deserve access to literacy. As Tracy said in the beginning, we want to think about what children can do and not be limiting them by what we interpret they might be able to do. So we want to think about developmentally appropriate strategies and interventions that consider their vision and hearing needs. And there's some of those that are here on the slides, like routines-based literacy, shared storybooks, experience books, all of the things that build opportunities for literacy for students, and to consider both their vision and hearing needs when we're thinking about what does literacy look like for one particular child. And then kind of last but not least, calendar or schedule systems, and I would add in here communication systems. So calendars and schedule systems are one way for students to, anticipate routines, make choices, understand their day. They can be simple, they can be very complex, but the point is that they require a team approach. They require teachers, service providers, families to really have an understanding of what the child needs, what they're able to do, what we want them to be able to communicate and understand. both receptive and expressive language. And so again, it's really thinking about that team approach. So Tracy, I'm going to pass it to you to talk a little bit more about services and advocacy.
Sure. So I just wanted to refer to a couple of questions or comments in the chat also. As we're sort of highlighting what we know is important and critical for many of the children that we're talking about tonight, we are also incredibly sensitive to what the world is facing right now in terms of a critical teacher shortage. And it's across the board, just in terms of gen ed as well as special ed. But I still think it's, if parents have the knowledge, they can really help a lot of teams as they try and move forward and access and align services to the best of everyone's ability. And with that, it's going to take even greater collaboration than we've seen in the past. And I can't imagine as a parent, you know, I can imagine how frustrating it is because I've witnessed it. But I just wanted to underscore that we don't have a magic bullet here in terms of how to solve some of these shortages. But I am really encouraged. We are working on a very big project for our grant around professional development. I'm not at liberty to talk about it right now, but we're getting close to really looking at how we can offer very specialized training to increase the number of individuals trained to work with this population, both deafblind and also related fields. So as you're thinking about advocating for services for your child, and I've seen this a lot in parent advocacy groups and agencies, the whole notion of being able to tell your child's story. So being able to answer that question of how does your child perceive the world? So when I go into classrooms, I often say to the team, tell me what she can see at near and distance and where you need to put materials. And every child working with that particular child, every provider working with that particular child should be able to answer that question. And I would also submit that families with the correct information should be able to tell that story of what their child needs to access visual and auditory information, because you're the best teacher and you can really beat that drum and make sure that everybody on that educational team can answer that question. When they walk into the class, they know where the materials should be. They know how your child, what your child can or cannot access in terms of vision and hearing. How does your child even use touch? Is that a really important additional sense that they rely on for meaning? Really understanding medical reports. And if you don't understand those reports, there are a lot of people out there that can help you sort that out. Your teacher of the visually impaired, your teacher of the deaf and hard of hearing, your speech language people, your physical therapy, OT, PT should also be able to help. Really, again, thinking about indirect versus direct, it's not an easy notion when we're thinking about balance, because I said, you know, only 30 minutes a month isn't enough. But I do think more isn't always better. So some families will go in and say, well, I need daily services for my child, when in fact a consultation model, if it's frequent enough, may be a really good match. And you're not going to know that until you have that conversation with service providers within that IEP process. So we also use two tools, Reach for the Stars and Charting the Life course, which are really fabulous in helping families kind of capture what are your non-negotiables, if you will, what's your wish list, and then really communicating what your child needs and sorting that out with the educational team. But I really encourage you to reach out for support, and Kristen will talk a little bit later about what's available in order to do that. Okay, Kristen.
Thank you, Tracy. You can flip to the next slide, please. So just for a minute, I will share with you what services are provided through NEC. NEC is federally funded, as the Federation is. So essentially, we exist for you, to support the families of children who have a combined vision hearing loss. I know I see some of the chats, and I know some of your children might not fit into that category. We're still here as a resource. And if that child can't be registered under NEC, we can help direct you to some other supports that may be helpful. So always feel free to reach out no matter what the circumstance. And sometimes we do receive a lot of outreach from families and professionals because they're not really sure if the child has a combined vision and hearing loss. And we can also help with that. Our services, we look at them as tiers, but very simply, we try to meet families and professionals where you are. Sometimes it's just that you need a resource. You just need to know you're going into an IEP meeting and you want to know a little bit more about functional vision assessment. You can reach out to us. You can go to our website and download or ask us to send you information on that, documents, reports, something like that. So that's our tier one. Really, it's information resources. You can find that on our website, through social media. Sign up for our newsletter. You do have to opt in. So if you go to our website, you can opt into our newsletter and our blogs. Our tier two is again available for everyone. So you can access we have trainings throughout the year. We have our training calendar just went up on our website. So I encourage you to take a look at that. There are several opportunities, focused on some different areas. We have workshops, conferences, and lots of family events. So again, you'll see that on our brand new training and activity schedule that's on the website. And our tier three, we do work with some teams around children who are deafblind in a more intense way, where we're really looking for child outcomes. Those teams are committed to working with us. Usually it's on a specific area of education. And that's something as well that, we can talk to you about, talk to the school team about getting that level of support. And the next slide, this just gives you an idea of some of the things that are available. Again, the best way to find out this information is you can always reach out to us or go to our website and look at our activity schedule. And again, you'll see that there are several events for families. And on the next slide, we outline some of those family activities that are upcoming for the next year between now and April. So we encourage you to spread the word, and they're really fun and ways to connect with other families. The apple picking is, as you can imagine, a really it's an annual event and a loved one by many. And on the last slide, you'll just see our contact information, how to get to our newsletter. Please, again, we encourage you, reach out to us, questions. If you know a child who might qualify for services, reach out or have someone on the team or a family member reach out. We're always willing to talk through it. And again, if NEC isn't the resource that you need, we can help direct you to other places. So I see we are just about at time. I'll hand it back over and thank you so much.
Well, thank you, Tracy, Brenda, and Kristen for a really informative workshop this evening. As always, the recording and the slides will be uploaded to our Federation website so that this information will be ready for you later on for you to reference. Which of course includes all of the wonderful resources and links that are included in the PowerPoint. So you will have a chance to access those. And as all of them have been so generous in sharing their time this evening, they've made it very clear NEC is a resource for families who are looking for some additional information and support and referral. So please be sure to leverage this incredibly wonderful resource. So with that, thank you again for joining us this evening and connecting families. We look forward to seeing you again next month in our next iteration of this. And in the meantime, Be well, stay safe, and always remember the Federation is here to support you in any way that we can. If we can't answer the question, we will find someone who can for you. So feel free to give us a call at any time. Have a great evening, everybody.
Thanks, everybody.
Thank you.
Thank you.
Thank you. Bye-bye.